Hello, my name is Andrew Brown. Today we're going to continue our pharmacology lectures, and today we're going to talk about patient safety. So, to begin, I would like to talk about the seven rights framework. So, the seven rights framework is essentially a framework that allows for safety in all circumstances when administering a drug, whether you be a physician or whether you be a nurse. So that framework allows us to just do a quick check before we actually give the drug to the patient. So to begin, the seven rights framework begins with the right patient. So this allows for the identification of the patient. Let me make sure that this medication is actually supposed to go to this patient. You'll see the person's name, date of birth, etc. So do I have the right patient? Next in the framework is the right drug. So looking at the medication, is this the correct medication that this patient is supposed to receive? You want to make sure that you actually have the correct medication because in a lot of cases, these are reactive molecules. You don't want to give a patient a medication that they didn't need and causing any unnecessary downstream side effects or adverse effects. Next is right dosage. So, dosage again is the amount of drug that you're going to give. So, you have a certain concentration, typically mass over volume. It could be mass over anything, but typically it's mass over volume. So, like milligrams per milliliter, etc. So, am I giving the right amount of that? So, like you'll have a formulated drug with a certain concentration, and then you'll have a certain volume that you're supposed to administer to give a total amount of drug to that patient. So, what is the total amount of drug to that patient? What is the total amount they need to receive per dosage? How many dosages do they receive in a day? So, right dose. There is also right route. So, as many of you know, and we've alluded to earlier, there are many routes for drug administration. You can directly go into the circulatory system via IV. You can go through the oral route and have your drug go through the drug cycle, where it goes through the stomach, goes to through the hepatic vein system into your livers, etc., etc., etc. So, am I giving this drug in the right route? Are they supposed to take it orally, IV, intramuscularly, etc.? The purpose of these drugs is to enter our circulatory system, and they have a certain lifespan in our circulatory system, and they can also build up over time. So some drugs are more hydrophobic, some drugs are more hydrophilic. We measure this with a parameter, the log P, which essentially describes how hydrophilic or hydrophobic they are. And depending on that log P or how hydrophobic or hydrophilic they are, they could build up in your system over time. Other factors determine this as well, but they can build up in your system over time. So you want to make sure that you're giving the drug at the right time. Has there been enough time in between dosage administration, etc.? Also, you want to make sure that you're supposed to give the drug at the right time of day, like nighttime or daytime, etc. So those are some of the reasons you want to know the right time that you're supposed to be able to give the drug. So the next is the right reason. So, as many of you know, drugs are essentially solutions to problems that we have physiologically. So sometimes they're curative, sometimes they're prophylactic, sometimes they're palliative, etc. So essentially, do I understand this person's disease? Is this drug going to be given in a manner that will actually help? Do I know the reason that this drug is going to be given? Can I describe that? So this is essentially me understanding what is the reason this drug going to be administered. Does it make sense? Do I understand the pathway, etc.? Essentially, am I giving this drug for the right reason? Next, we have right documentation. So this is essentially the who, what, when, where, and why of drug administration. So right after you administer the drug, you're going to document it. And essentially, as I mentioned before, you're going to describe who, what, when, or why. You never want to document a drug administration that you personally didn't administer. You never want to document a drug administration before you actually administer the drug. So yeah, this is just documentation so everyone knows, everyone has a record of who, what, when, where, and why of drug administration, just so that if anything goes wrong, we always can look back, see the history of the documentation, and then figure out where things went wrong. There is also sometimes people include right technique. So, whether you're giving IV, IM, sublingual, you want to have a great technique when you're giving the drug so that it actually goes in the route, in the necessary rates that we expect. So if it's IV, we definitely want it to get straight into that circulatory system. So that was the 7 rights framework that is used to keep patients safe, and when we're administering medications and pharmacology. So when you're administering medications and pharmacology, you also want to be aware of certain abbreviations that describe how to administer a medication and when to administer a medication. So you can see an image of very common abbreviations on my screen. Some of them include, for example, BID, which would mean the dose is taken twice a day. There's ID, intradermal, IM, intramuscular, IV, intravenous, NPO, nothing by mouth, etc., etc., etc. So you're going to want to make sure that you fully understand these, like really, really well, because you're going to want to be able to recognize them when you come across them, when you're dealing in the field of pharmacology. So moving on, I'd like to bring up a topic that was talked about before. I'd like to re-bring it up: the therapeutic range or the therapeutic window. So essentially, the therapeutic range or window, or however you want to describe it, is the range in between the minimum concentration for a drug to remain efficacious in the blood. So like the minimum concentration in the blood that a drug can remain efficacious, and the maximum concentration before you start to see toxic effects. So the minimum concentration that you need in the blood for the drug to actually do what you wanted it to do, and the maximum concentration before the drug starts having some downstream toxic and sometimes adverse effects. So it's kind of that sweet spot that we want to keep the drug concentration in the body, in the blood specifically. So there's some factors that can essentially move that sweet spot up and down based on the patient. So some factors that can influence this sweet spot that I was talking about, or the right dosage and slash the concentration that we need the patient to have in the blood for it to have a good effect and not a toxic effect, includes physical activity and nutrition. So sometimes, you have some foods that are very fatty, and again, we have factors like the log P of a drug determining how hydrophobic it is or how hydrophilic it is. So that can kind of affect how it will build up in the body system. So sometimes drugs, some of the hydrophobic drugs will build up in our tissues over time. If you eat a lot of fatty foods, that can affect that. Also, if you eat a lot of, depending on what type of food you eat, it can alter the build up over time. Also, if you have someone that's very physically fit, sometimes their metabolic systems are upregulated, so this could also affect absorption. Also, something to note is that most drug dosages are based on like the average body weight, which is around like 150 pounds. So if someone's less than that or more than that, you'll often need to the dosage will often need to be changed to hit that sweet spot. Next, we have age. So in the case of geriatric patients, sometimes their organ systems are not working as they used to. So they may have decreased absorption, slower distribution, etc. So just some things to think about with geriatric or older patients. We also have pediatric patients. So pediatric patients have typically usually a lower body weight. They also often have very high metabolisms, etc. And there's also gender. I talked about the log P of drugs and determining how fatty they can be, etc., which will affect how they build up over time. So sometimes gender can affect, the dosage. So often men have more muscle than fat. So that's something to keep in mind with hitting that sweet spot that I keep bringing up. Um, and vice versa, women will typically have more fat than men, percentage wise, like percentage body fat. Also, often men tend to have higher rates of metabolism. So every case is different. You can have some women with high metabolisms as well, some men with low metabolisms. These are just like averages, like on average what we see. So gender can affect, where the concentration we need to hit that window, the therapeutic range. Also, environmental factors can affect the therapeutic range or the dosage that we need to give. So typically, a drug can be metabolized quicker if someone smokes. Smoking can upregulate your metabolic systems. Also, even secondhand smoking can do that as well. So your environment can affect the dosage needed in the blood as well. So another factor is if someone's pregnant or not. So you have, for example, we talked a little bit about barriers, right? So barriers, cellular barriers in areas that we don't want different molecules to go. That's kind of how the body works. For example, the blood-brain barrier is essentially a barrier of cells around, your brain to prevent different molecules from directly going to your brain because that's a precious organ. Likewise, if someone's pregnant, there is the blood placental barrier, which can affect the blood placental barrier is meant to protect the fetus from different medications. So you want to be aware that if someone's taking a medication, how hydrophobic is that medication? Because if it's very hydrophobic, it may be able to get through the blood placental barrier, and that's something we typically don't want. We typically don't want the fetus, the growing fetus to be affected by medications that's only supposed to affect the mother. So that's another factor that we would think about when we're thinking about the concentration that we want in the blood. So if a person is pregnant, that can affect that amount that we give. Maybe we'll give less of a medication. And there are also patients with organ dysfunction. So like, for example, if we're giving a prodrug, which is, remember, a drug that is essentially taking advantage of the liver's system's ability to break down a drug into a smaller and more soluble drug so we can excrete it through our kidneys. So if you're having issues with the liver, like if your liver is not functioning correctly, this would affect whether we can even give a prodrug or the concentrations that we'll give in different scenarios for different medications. Also, for medications like the kidney, if you have a dysregulated kidney, maybe you'll need lower concentrations of many different molecules so that, because your kidney's not able to filter as it previously did, perhaps you'd have to lower the dosage. So these are different factors that will affect the therapeutic range that we want the drug to be inside of a certain patient, and therefore downstream also affect the dosages that we'll give said patients. So that concludes the lecture on patient safety and medication administration. Take care.